Well, the sun is out and it looks like summer is here at last. And a question I get asked a lot is, now I've had my veins treated, when can I get them out and get the sun on them? Well, let's face it, it's one of the commonest reasons people have their veins treated in the first place, to make their legs look better and to show their legs off. Well, there are three things you might want to consider. The first is that after any vein treatment, your legs will be a little sensitive to the sun. There's a healing process that's going on underneath the skin. Although these treatments are minimally invasive, there is a healing process which needs to be completed, and it takes several weeks and months. And during that time, certainly prolonged or intense exposure to sun can cause redness and itching and discomfort, and you might want to protect your legs from the sun during this time. The second reason you might wish to delay sun exposure is that your legs are not going to look their best for a few weeks. Now, there's a lot of hype. Some clinics regard these treatments as a lunchtime procedure, instant results. Well, in my experience, it's just not true. Sure, your legs will look a lot better very quickly, but there will be some bruising, there may be some discoloration, and your legs probably won't look their best for about 6 weeks. If you've had sclerotherapy, particularly for thread veins, the healing process can take a long time, and it may be several months, if not a year or so, before you see the final improvement of your treatment. The third thing you may wish to consider is that after vein treatments there will be some degree of brown discoloration of the skin. Now, some of this is true pigmentation. It occurs whenever there's an inflammation or healing process either in the skin or nearby. This inflammation or healing process stimulates melanocytes that produce melanin, and they become active, and you may get some pigmentation along the course of treated veins, a particular issue after sclerotherapy. Some of it is due to bruising or little collections of blood under the skin, and the hemoglobin does cause discoloration of the skin. The technical term is hemosiderin, and it's sometimes described as staining. I don't like this term. It implies that there's been an accident and something's been spilt, and that's not true. It's all part of the process, and some degree of brown discoloration is inevitable. So your legs won't look their best. Now, this brown discoloration always goes, it's never permanent. It is largely gone by 6 months, but it can, in some cases, take up to 2 years to go completely. I've never seen any brown discoloration persist for beyond 2 years, but we do know that sunshine and intense UV exposure darkens this discoloration, and it takes longer to go. So there you are. Those are the things you may wish to consider about exposing your legs to sunshine after vein treatment. Now, I hope you found this video interesting. Do please remember to subscribe by clicking on the link here. And if you have any comments or questions, I'd really like to hear from you. Please leave these in the box below. Thank you for watching.